everyone. Thanks for joining. We're going to get started now. We have Dr. Moore here today, so I'll turn it over to him for some brief remarks.
Good afternoon, everyone. Bon après-midi à tous.
Good afternoon, everyone.
There were 748 new cases of COVID-19 in Ontario. There are 257 people in hospital, 137 in the intensive care unit due to COVID-related critical illness. And I'm sorry to say that another 5 Ontarians have died as a result of COVID. A total of 33,932 tests were processed yesterday with a positivity rate of 2.6%. And currently, 89.8% of eligible Ontarians over 12 years of age have 1 dose, and 86.8% have 2 doses of a COVID-19 vaccine. Vaccines for 5 to 11-year-olds. It's been an exciting week. Our kids in the 5 to 11 age group are finally eligible to receive the COVID-19 vaccine. Cela a été une semaine.
This has been a very exciting week. The children within 5 and 11 years of age can receive the vaccine.
Vaccine appointment through a variety of channels, including the provincial vaccination portal and contact center, directly through local public health units using their own booking system, participating pharmacies, and select primary care and pediatric providers. Children in this age group will receive the pediatric Pfizer COVID-19 vaccine. This vaccine is a lower dose, 1/3 of the amount given to individuals aged 12 and over, and will be provided in a 2-dose series at a recommended interval of 8 weeks between the first and the second dose. We have unfortunately seen case counts and hospitalizations increase in this age group, so having the vaccine available will provide our children with a strong level of protection against COVID-19 and the highly contagious Delta variant. It will help keep our schools safe and open and stop the spread of the virus. Every percentage point as a population that we have protected through immunization is a reduction in transmission at the community level. So getting vaccinated not only protects you as an individual, but also your loved ones and your community. I know many parents and caregivers have questions about the safety and efficacy of the vaccine and may feel hesitant about getting their child immunized. There are many resources to help you to address these concerns, and I would encourage those with questions to call the Provincial Vaccine Confidence Line or book a confidential phone appointment with a sick kids clinician through the COVID-19 Vaccine Consult Service. It's understandable that parents and caregivers would have questions, and we want you to feel supported and respected as you make your decision. Nous comprenons que les parents
We understand that people, and parents especially, are hesitant. We want you to feel secure and respected when taking this decision.
While it is exciting that our 5 to 11-year-olds are finally able to get vaccinated, there are also many people eligible for the booster dose who need to come forward and get their shot. I am strongly encouraging you to book your appointment as soon as possible to get maximum protection against COVID-19. As families are booking vaccine appointments and making plans to get their children immunized, I know that the winter break and holiday planning are also underway. If you are planning to travel this upcoming holiday season, it's strongly recommended that you be fully vaccinated. Si vous prévoyez de voyager pendant la saison des fêtes,
If you're planning on traveling during the holiday season, it is strongly advised that you would be fully vaccinated.
You should avoid non-essential travel to all destinations. Regardless of vaccination status, if you choose to travel, please practice personal public health measures, the very basic common measures of masking, distancing, hand hygiene while away and upon your return. Travelers should stay informed about the COVID-19 situation at their destination and follow all local COVID-19 restrictions. If any traveler is symptomatic upon return, even with mild symptoms, please get tested and stay home until you have your results. And if you plan on traveling internationally, remember to follow all the rules and regulations outlined by the federal government. Whether you are traveling or choose to stay local, always remember to stay home if you have symptoms, even if they are mild, and if you are in quarantine or self-isolation. Wash your hands thoroughly and regularly. Cover your cough and get tested if you have symptoms compatible with COVID-19. You should also make mask wearing a part of your regular routine. Vous devrez également intégrer le port de
You should wear your face mask as part of your daily routine.
even if it isn't required, you should wear one in private indoor spaces if those around you are from multiple households who are unvaccinated, partially vaccinated, or their vaccination status is unknown. And remember to wear the mask properly. It should fit well, cover your nose, mouth, and chin. Also remember, if you're hosting or attending a social gathering, there are still limits of 25 people indoors and 100 people outdoors. Use outdoor spaces whenever possible, and if it is too cold, ensure that the indoor setting is well ventilated. Wherever you are planning on spending the holiday period and the new year, please do so safely. We are seeing the expected increase in cases, and we do anticipate that they will continue to rise over the holiday period. This pandemic is certainly not over, but by getting the first, second, or third doses of a COVID-19 vaccine and by consistently following those public health measures that we know work, we can reduce the risk of transmission and have a happy and healthy festive season. I do want to take a moment to wish those members of our Jewish community a very happy Hanukkah, and you begin your celebrations on Sunday night. Thank you and merci.
We'll go to the phone line.
As you begin.
We'll go to the phone lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
From Nick Dunn at TV Ontario.
Hi, Dr. Moore. I have a question regarding Northeastern Ontario, the area which I cover for TVO. We're seeing quite elevated case rates up here, and in speaking with Dr. Glenn Corneal, the medical officer of health for the Temiskaming Health Unit, he suggested that one possible reason for the spread here is that these regions hadn't necessarily been affected in the previous waves, and that perhaps it is because of this there might be less immunity in the regions. I was wondering if you had any thoughts on this theory and any other factors for why we're seeing such high rates in Algoma, Sudbury, and Temiskaming.
Yeah, well, my heart goes out to those communities in the north that are experiencing higher rates, and I think he is right in suggesting immunity to this virus can be acquired either through vaccination, and I'm happy that in the north they have good vaccination levels, and or with acquired infection. It just so happens that the north has been spared significant impacts through the first, second, third waves. We know Toronto, Peel, the GTA area had significant impacts in that third wave, but other areas of the province haven't. And what we're seeing now as a result is those that don't have a significant amount of natural immunity in partnership with high vaccination rates are having increasing risk. And we're in regular contact with our colleagues in Temiskaming, in Sudbury, in Algoma Public Health. We're trying to provide provincial supports to them to ensure that they have good capacity for case and contact management, that they have good capacity to continue to provide first, second, and third doses of vaccine in those communities, and the childhood strategy. they will continue to have increased risk in those communities over the coming weeks, and we aim to fully support them to respond to this threat. It's very similar to what is happening in my prior health unit in Kingston, Frontenac, Lennox and Addington, as well as what's happening in the Southwest. The rates will slow down as we build immunity through immunization, but sadly we will also have to build immunity through individuals who haven't been vaccinated who will get the illness. So anyone in those communities, please, if you haven't been vaccinated yet, please consider getting your first dose. Get your second or third dose if you're eligible. Continue the basic public health measures that have done us well through the previous waves. They do work. And in those communities, we're working with the medical officers of health to enable them, if necessary, to have additional measures to limit the spread in those communities.
Follow-up?
Yeah, as a follow-up, within the situation in Sudbury, we're looking at nearly 100 cases in Sudbury area schools. And this is coming, of course, as vaccines are rolling out for 5 to 11-year-olds. There doesn't seem to be any suggestion yet that they're looking to close the schools, but I'm wondering if the vaccine rollout is enough to curb the tide in regions where we're seeing high levels of outbreaks and cases in schools.
So in the school setting, absolutely, in these communities where you have high community transmission, there will be a risk to the schools, and more children in the 5 to 11-year age group will come down with the virus. The strategies that we're working on in the schools to keep them open are to keep lunchrooms in your classroom only, to have virtual assemblies starting very soon, to increase screening, increase testing capacity in those schools that are experiencing any activity, and as well, the silver lining is that the vaccine will be very effective over the coming weeks and months to decrease the number of outbreaks and or risk in the school settings. So we are working in partnership with all of the health units that have increased activity now to advise of how to continue to make the schools safe. The vaccines absolutely will make them even safer as a higher proportion of children get immunized. So in the new year, after the second doses, we really do anticipate seeing a decrease in the number of children affected. As we've seen in high schools, the number of high school outbreaks are often limited, smaller numbers of students, and less risk to the school. But I think you've heard from all medical officers of health, our goal is to keep schools open. They should be the first to open and the last to close, and we will do our utmost to maintain in-person learning throughout Ontario.
Next question.
From Colin DeMello at CTV News.
Hey there. Good afternoon, Dr. Moore. So 5 to 11-year-olds who are getting vaccinated as of today, they are going to get a vaccine certificate and a QR code. I'm wondering if the province is planning to apply the same certification rules to that age group as applies to everyone else 12 plus. And should private organizations, in your view, like sports venues, like the Rogers Centre as an example, apply vaccination rules, proof of vaccination requirements to that age group 5 to 11?
Because this is such a new rollout, and we want parents to feel confident in the decisions that they make and not feel coerced by any means, we want them to make a judgment based on the risks and the benefits of the vaccine. And in my opinion, the vaccine's benefits far outweigh any risk. We do not anticipate putting the verification process or making it applicable to the 5 to 11-year-olds. The government has not made any decision in that regard. Any independent business can make a decision separate from government, but it would not be our advice at present to include it in any certification process. We need time to continue to immunize these children, to continue to demonstrate the safety and efficacy of them. Millions of children in North America now have received the vaccine. The safety evidence continues to build that they're just as safe as the 12 and over age groups, but it would be very premature to mandate their inclusion, in my opinion, and I do believe of that of the government, into the verification certification process at present.
Follow-up?
Okay, thank you. I appreciate that So if the province is not applying them to the youngest Ontarians, why are they still being applied to older children? So, for example, the current proof of vaccination rules apply to a movie theater. What is the difference between an unvaccinated 11-year-old and an unvaccinated 12-year-old sitting in the movie theater together?
The major difference is the length of time we've had and the breadth of science and study of the vaccine and the benefits in those age groups. We will review the science and the benefits over time because it's a new vaccine and we're one of the first countries, we're the second that I'm aware of, that have adopted this vaccine for this age group. We need prudence. We need time to review it before it would ever be part of any mandate. I think that's putting the cart before the horse. And we do have good science for the 12 to 17. We've established its safety, its efficacy, its benefits, and hence it was included in the verification certification process. And we just need to build that evidence base of the vaccine. It's new, it needs time, and we'll build the science to support its implementation. But it's a brand new rollout, so I honestly don't see its integration into the verification process at all.
Next question.
From Holly Mackenzie-Suter at the Canadian Press.
Hi, Dr. Moore. I have a question about kind of just the infection curve that we're seeing right now in the province that's been going up basically for the past month now. Like, do you consider this to be the fifth wave of COVID-19 in Ontario? And if not, how would you define the curve as we're seeing it right now?
It really does appear to be a continuance of that fourth wave that we experienced in September. The case counts really never got back to a low level, and it was anticipated that it would continue as we go indoors into crowded spaces, close spaces, and closed ventilation systems. So we absolutely knew that the risk would continue. So we never declared the fourth wave over. This is simply a continuance. And sadly, all modeling would predict this would slowly, steadily rise and increase over the coming months, including January and February. So all of us in Ontario, in Canada, in Northern Hemispheres have to remain vigilant. We all have to continue to adhere to the best practices. And we have still a ways to go to provide first, second, and third doses to best protect Ontarians against this formidable foe. It just continues to want to spread, and it won't slow down again until we get outdoors in the springtime. So we do have a time period over the next 4 months that we'll have to continue to be very, very vigilant, monitor the impact on our acute care sector, monitor the number of individuals having to be admitted to the hospital, and ensure where we're seeing increased hospitalization that we put in public health measures to limit the spread. That will all be done at a regional level, at a local level, and we've got systems in place to support what's going on in Sudbury District, in Algoma, in Temiskaming, in the Southwest, and now in KFL&A, and bring them the resources to help limit the spread in those communities.
Follow-up?
Yeah, follow-up is on the school outbreaks and cases that we already talked about a little bit. Just today there's 16 closures related to COVID reported in the province, and some of the opposition, other families are saying, why not make the rapid test available to all students now rather than wait for the December break? If you could explain the rationale for that. That
strategy of the December break, of the testing for every student in Ontario, 5 tests to go home with, I think is has strong benefit at a community level to make the holidays safer and make the return to school safer. We have the ability to provide rapid tests and enhanced testing in any region of this province that is experiencing increased activity. So we are in active discussions with Algoma, Sudbury, Temiskaming, other areas to be able to bring rapid testing to those communities based on their rising risk and the increase in number of cases. We can have testing to stay, testing to play, testing also as a surveillance tool to enable increased capture of cases and prevention of spread. So that capacity is there. The dialogue's ongoing in the highest risk areas of this province, and the laboratory system is maintaining very good turnaround time with good capacity, and public health's turnaround time for case investigations still 95% within 24 hours of cases are being contacted and they're being isolated, and the rest of the community is being protected. So I do have to thank all Ontarians for continuing to adhere to the best practices, to coming forward to getting tested when they develop any symptoms of COVID-19, and our great partnership with our labs, our health units, our hospital assessment centres is working to limit the spread. But this is a nasty, aggressive virus. This is the time of year where we expect an increase. And sadly, yes, we'll see increased cases in school settings, especially the elementary, where they haven't had the benefit of vaccine. The silver lining, though, is that we now have the vaccine. So for parents, I think one of the key motivators to get your child vaccinated is the decrease in risk amongst the school setting, the social setting, or in the home setting of transmission, because the vaccine is very powerful at preventing infection, around 90.7% protection against symptomatic COVID-19 in the randomized control trials. That's just brilliant level of protection. And that should limit the spread in the home setting to vulnerable members of your family, in the school setting, or in social settings. So I do hope that all parents consider getting their child vaccine. I absolutely fully support vaccinating that age group. Understand that's a difficult decision. Our health system is here to answer your questions, but it really should help limit the spread in the elementary school setting. First doses will be helpful. Second doses will be tremendously beneficial against Delta on limiting the spread. So there is hope. I know this is a difficult time, but there's a hope now that we have the vaccine, that we can have decrease in impact on our elementary school system.
Next question.
From Rob Ferguson at the Toronto Star.
Hi, Doctor. I just wondered, there's a lot of concern about low uptake of the boosters, and I'm wondering if there's any kind of moves afoot to, take bigger steps in terms of getting people to take advantage of that, and whether you would expand the boosters. That's happening in a lot of jurisdictions, the U.S. and in Europe.
Oh, thank you so much for that question, Robert. So just to reiterate, those that are eligible right now are those 6 months after your last dose, 70 and up. We've had good capture of the 70 up, especially in long-term care facilities and retirement homes, and we're seeing great protection in those environments, very limited outbreaks, limited complications associated with COVID-19. So thank you, all those that have taken up the third dose in those settings or provided the dose in those settings. But 70 up is a key target. Look at the last time you received your second dose. 6 months post, 168 days post, you are now eligible. I absolutely want to see our over 70 population protected with their third doses. Boost your immunity within 7 days. Decrease your risk over these holiday season of getting COVID-19 and having severe complications of it. Anyone that's been immune suppressed, the list of medications is on our website, ontario.ca, where you can see if the medication that you're on makes you eligible for your third dose, or if you're a transplant patient. If you're a healthcare worker, getting immunized protects you, decreases your risk of transmission in the healthcare setting if you care for vulnerable populations, and also protects your family. First Nations Inuit Métis, please, we've partnered with your healthcare organizations to provide the vaccine and absolutely want you to have your third dose 6 months after your last. And those that have had 2 doses of AZ, AstraZeneca, or 1 dose of J&J, we'd absolutely recommend a third dose with an mRNA product. Those are the main categories of individuals we'd love to come forward as soon as possible as the risk increases across Ontario. You get immediate, within days, a boost in your immune protection against COVID-19. It will be very timely for the next several months where the risk across Ontario is going up. We only have to look at some of the European countries where this is a natural time where this virus naturally wants to spread aggressively, and I'd love to see anyone vulnerable boosted. In terms of expanding the booster, we're absolutely looking looking with government on how to do that. We want first to ensure that those major groups get their third doses, and then the 5 to 11-year-olds get their first and then second doses. And in between, when we see a capacity improve, I do believe the government will make declarations on expanding below the 70 age group very rapidly based on evidence that the third dose is required and beneficial in those age groups. I do also just want to reiterate that these vaccines, even 2 doses, are proving to be quite powerful, quite protective, but there is a drop-off based on age and based on those groups that we've mentioned on immune protection that a third dose absolutely provides a boost to and further prevention against any of the harms of this virus. So thanks very much for the question. We really need to get that across as many avenues as we can, whether it's through hospital networks, through our healthcare workers, or directly to the public about getting that third dose. It's very important, and you'll be hearing news soon, I think, on an expanded eligibility for third doses that will follow the science.
Follow-up?
Thanks, Doctor. Do you expect the timeline to advance? I think previously you said that...
Rob, we cannot hear you.
Until the new year. So is that going to be moved up?
I do anticipate that it'll be moved up. We're just looking at capacity of the system to deliver. So we're working with our pharmacy partners, our hospital partners, primary care, our pediatricians now. Some offices are delivering vaccine, as well as the hardworking local public health agencies are organizing mass immunization clinics, pop-up clinics, mobile clinics, and at the same time, they're also delivering influenza vaccine. So there is a fair bit of pressure and fair demand on the system at present, but you can anticipate we'll be making, the government will be making decisions on improving the access for third doses in the coming weeks. But we're just reviewing the science, the capacity of the system, and certainly our number one priority are those groups about the current third doses as well as the children 5 to 11 right now to ensure that they get access rapidly and quickly as we head towards colder and darker days.
Last question.
From Natasha MacDonald at Radio-Canada.
Hello, Doctor. Can you give an update on the outbreak of blastomycosis in Constant Lake First Nation? What's the province doing about that right now?
Well, it's quite disconcerting, and my heart goes out to the community and to Chief Ramona Sutherland. She's been a great leader of the community and the Mattawa Chiefs Council. This is a very rare infection. To have the numbers of cases that have occurred in that community is quite startling. We've brought multiple provincial resources to bear and support the community, from the laboratory system, from the healthcare system in the Hearst Hospital, to enhancing the access to infectious disease expert, both pediatric and adult, and to ensure that the community is getting appropriate screening, testing, as well as access to treatment. We've also brought in experts on the environmental concerns, because this is a rare fungus that is typically found in soil or on decaying materials such as wood. And it may be a sign of further climate change to have a community that far north starting to have blastomycosis. Typically, blastomycosis needs certain temperatures. It typically stays around the Great Lakes and down the Mississippi Valley. And to have it this far north in a large outbreak is very disconcerting. So we're trying to provide, together with our federal partners, as much resource to assure the community that they'll have the access to health care, the treatment that's required, and the investigation as to how this developed in the community being done. There's snowfall now, apparently, so from an environmental testing vantage point, it's a little more difficult. But I assure you, we're aware of this. We're supporting the community. We're providing the resources that are essential to protect them, to treat them, and to get as to the cause of how the community got exposed to this.
Follow up, and this is the last question.
My follow-up's for one of my colleagues. She's working on a story about plexiglass. There's some experts saying that they may be counterproductive to proper COVID-19 ventilation. So do you have any thoughts on if businesses and establishments should still be using them at this stage of the pandemic?
Well, I think we're learning more and more that ventilation is a very important component of the hierarchy of protection, and that any company that owns a building should be ensuring that they're adequate maintenance of their ventilation system, they're changing their filters on an ongoing basis, that they're ensuring that if they have an air exchange system, that's being cleaned, but that's being maintained, and they're maximizing their air exchange where possible, if the weather permits, maximizing outdoor natural air getting indoors through opening windows, etc. All of those metrics are exceptionally important. Physical barriers and separation are important as well to prevent the largest number of droplets going between people. So we do want physical barriers as well as improved ventilation in businesses to help protect and decrease the risk of transmission of COVID. But they're all part of an integrated series of requirements to protect workers and or the public. And that goes to the basics of not going into a business if you have any symptoms of COVID. If you have symptoms of COVID, stay home, get tested. And as well as if you enter a building, make sure that you have a properly fitting mask, that you've done good hand hygiene, and that you're distancing as best you can within that environment. So a physical barrier like plexiglass does have a role to play, but it's part of an overarching hierarchy of controls that will decrease the risk of transmission in a workplace or in a public setting. I hope that's clear, but if there's a particular question about plexiglass, I'd be happy to try to respond to that more fully afterwards.
Okay, thanks everyone.